Hello, friends, and welcome back to my channel here at True Reality Life, where we talk about the true realities of the life around us, beautiful, ugly, and everything in between. So, today I wanted to talk about the grief before loss. If you watched my last video, it was grieving after you've lost somebody. So, if you feel like you need to go watch that one, you can watch that one. But this one is mainly focusing on the caregiver strain and the grief that may happen with an expected loss before losing them. So, if you are a caregiver to one of your loved ones, or even if it's a professional caregiver and you're just looking for some ways to cope or some form of understanding of your experiences in that end of life care process, this video is for you. So thank you so much for being here, and thank you for your love and dedication to those in need, whether it's a loved one or a complete stranger. So we're going to jump right into it. This came up because as I was talking about grief after losing somebody, I was just realizing how I kind of talked about the sense of relief that can come from losing somebody, which, whenever you say it out loud, it sounds absolutely horrible to say that you feel any sense of relief from the loss of somebody, from somebody dying. That sounds horrible, but it's also such a valid feeling sometimes, especially if you are an end of life caregiver for an extended period of time, because it's exhausting. It can be so, so exhausting. If you've ever been in that position to have to take care of somebody in their last days, weeks, months, however long they're not really moving around or needing total care around the clock, it's exhausting. It's so exhausting. And so I'm going to kind of touch on from like a loved one's perspective, and then also from a professional perspective, because I was a hospice nurse for a little while in my career. So I know the strain that comes along with that, and the sensitivity that you get from it, I guess, if that's a word. But let's start with caring for a loved one. So a lot of times we see this in older couples when one of either the husband or wife is declining or goes on hospice and ends up in their end of life period before the other one. And so say they're both elderly and one is declining a lot faster, then it ultimately is leaving the responsibility to care for that person to the other one, the other spouse, which isn't always ideal because, especially in your older age, you might be weaker, you might have your own health issues, things like that, that puts a strain on you to take care of your loved one. So this came up in my husband's grandfather that passed. His wife was taking care of him in his last weeks, probably over a month or two, and she ended up hurting her back and not being able to go to the doctor and things like that because she was so focused on her husband. And this comes up so often in couples that stay together until the end of life and follow through with their vow and their marriage to each other. But it becomes such a strain on that person. I don't necessarily want to say burden, but if you feel like burden is a valid feeling for you, then that's okay too. Don't feel guilty about that because it can be. You kind of have to put your whole life on pause in order to take care of somebody in their end of life stage. So if that's at home and they're at home hospice and they're too weak to eat and you're having to help them eat, or too weak to get up and you're having to turn them or change them if they're urinating, or the alternative in the bed and you're having to help them. The goal and hope is that there's family or healthcare professionals that can be of assistance, but that's not always the case. And So sometimes it's left to the wife to take care of the husband, or the husband to take care of the wife, or even if it's kids coming to take care of their parents in their last days, weeks, months, whatever it may be. It's a lot. It's a lot on that person, that caregiver, because it's around the clock care. And then there's that anxiety that comes with it of, especially whenever it's getting close and that loved one is declining. You're just waiting. You're scared to walk into the room because could this be the time that I walk in the room and they're not breathing anymore? So that anxiety that comes with it, but it's also the grief that comes with that. There's a lot of grief that's already happening even before the loss because you know it's coming. So you're grieving and you're trying to mentally prepare for the idea of this person isn't going to be here with me. What am I going to do? But you're so focused on taking care of them and hopeful, but it's a constant battle. So it's a physical exhaustion of taking care of them, it's emotionally and mentally exhausting. And then it can be financially exhausting if you're needing equipment or certain care or whatever it may be in order to take care of this person in their last days. So it can be so much. And so often these caregivers completely neglect themselves. They don't go see the doctor if they need to be seen. They can injure themselves if it's an elderly person trying to do too much because they want to be there. They want to be supportive. But if that's you, it's okay to take a break. It's okay to rest. And it's okay to ask for help because so many times people are stubborn and they think, well, I can do it. It's my responsibility. It's my spouse. It's my obligation and my vow to this person to take care of them even until their last breath. But if you're not in the physical or emotional capacity to take care of them, sometimes it's better to just ask for help if you can. If there's other family or if there's caregivers that you can reach out to for help and resources, please do that. Please, please, please do that because they will be getting, your loved one will be getting the care that they need. And I know we try to do our best, but sometimes us neglecting ourselves is then ultimately neglecting our loved one as well, even if we mean well. It's just a huge strain and it's a lot. It's overwhelming and you really feel like you're putting your whole life on pause even if it's for months. It's like those months just disappear because you have one goal. One purpose is to take care of this person 24/7. So you're constantly trying to tend to them if they can't get up. What do they need? How can I make you comfortable? What can I get you to eat? Stressing about doctor's visits if they're not on hospice yet, but having health issues or anything like that. So I just want to recognize the strain and the struggle that does come along with end of life care, even prior to the loss of the loved one. And know that whatever feelings that you're feeling right now, if you are a caregiver to your loved one, your feelings are valid and it's okay to take a break and process those feelings because it's a lot. And it's so easy for us to focus on somebody else and neglect our physical and mental health. But then that's ultimately what gets scary where people that are married, if this one person passes away, then it's always predicted that the other one will pass not too long after, just because they feel like they don't have a purpose anymore. They feel alone. They feel exhausted. They've neglected themselves for so long that now they're facing their health issues. So it's just a lot. And I just want to recognize you if that is you. It is a lot. And it's okay to feel stressed out. It's okay to feel overwhelmed. It's okay to feel exhausted. It's a part of life and nobody should have to experience that, but unfortunately it is the guarantee in life. And I'm sure they are so grateful for you, whether you're a child, a wife, a husband of somebody who's in their last days. They are so grateful to you. It means so much because not everybody has that person. And that's why from a professional perspective on hospice care, it was so sad sometimes to see people there that had no family to support them, to be there with them in their last breaths. And so it ultimately went on to the nurses to be there for these hospice patients. And it's a lot of strain on them too. So if you're a nurse or a tech or any kind of healthcare professional, whether it's in home health or in the hospital setting, thank you. Thank you for being the support system in the last days. Thank you for providing that care where family may not be able to, or just adding additional support for that family and working together as a team to take care of these people, these complete strangers to you, and putting your all and your heart out there to take care of these people in their last days. You are making such a huge difference in this world, and you are so valued. And I know it's exhausting, it's emotionally draining, but it's so needed. So thank you. And as the same as a loved one, it's okay to grieve, it's okay to feel overwhelmed, all the feelings that come up. But it's also something I notice a lot in hospice healthcare providers is you become desensitized to it all. Death becomes normal. And I know it is like a normal thing in life, but no person should be exposed to death that much. And I know it sounds morbid, but I actually really did enjoy being a hospice nurse to be there with people in their last moments and with the families and being able to offer that support and closure for them. So I know it can be rewarding, but it's also, I look at myself now and how I handle death, and I'm very shut off to it all. And I don't know if that's something I still need to process, probably. But I know healthcare providers just become desensitized to it all. It just becomes a job, a regular thing. And I know hospice nurses can definitely, they're still very empathetic and compassionate, but there is such a thing as compassion fatigue, and, and where it's just too much and you shut off your emotions, that you can still go through the motions of being there and supportive and things like that and still making a difference. But ultimately, once you go home, you clock out, you shut off. Because if you didn't, it would be so overwhelming unless you process it. So, for whether you're a care provider of a loved one or of complete strangers, just make sure to take time for yourself and acknowledge the feelings that you're experiencing, the same as what will happen once that person has passed. Just let yourself experience the feelings that come up and validate them and recognize that it is okay to feel relief. It is okay to feel a weight lifted off your shoulders. It is okay to feel angry and sad and exhausted and helpless and all of the things that you're feeling. That's okay. And I really hope if you are struggling that you are reaching out for help because you're only human. We can only do so much. We only have a certain threshold that we can tolerate. So please recognize if your body is trying to tell you that you have met that threshold and reach out for help. If you ever need to speak to me, you can always message me, reach out to me. I'm always here to be your support, to give you some guidance and some reassurance if you need it. And if not, there's always, you can reach out to a loved one, a close friend, whatever it may be. But please seek help if you need it, even if that's like physical help with your loved one or even yourself if you need to go to the doctor and you haven't made it yet because you're so focused on this person, or going grocery shopping sometimes. A lot of loved ones are scared to even leave the house for anything because, you think, oh, the second that I leave, that's when something bad's going to happen. So it makes that anxiety level just rise. And sitting in high anxiety and high stress for long periods of time, if it's an extended end of life hospice experience, oh, that takes such a toll on you. Your body cannot function in that state of stress and anxiety for long periods of time without shutting down. So please recognize if your body's trying to tell you something, and just know you are appreciated, you are recognized, you are valid. Any feeling that you're feeling is so valid, and it's okay to feel these things, and it'll only be temporary. You are so, so strong, and you are so needed. So thank you. Thank you for being there for these people in their last days. I know I would want somebody there with me in my last days. So thank you. And thank you for being here and watching this video. As always, you can reach out to me for questions or just to vent if you need to. I'm here. But thank you for your support. Love you guys so much. See you next time. Bye.